Hello everybody, this is Dr. Omid, and in this video I'm going to talk about the female genital organs. I hope this video it will be useful for you. Thank you.
So, regarding the female genital organ. Female genital organs, like male genital organs, we divide them to two parts. The external female genital organ and internal female genital organ. Regarding and concerning the internal female genital organ, we have ovary, which is identical and synonymous in male like a testicle or testis. Then we have the fallopian tube or uterine tube. Then we have the uterus. This ovary, they are paired. Fallopian or uterine tube, they are paired. The uterus is not paired, is the unpaired organ. And then it's vagina. And then we have the external female genital organ that generally is called pudendum or vulva, they call it, except the mons pubis, they call it vulva. But generally the pudendum, it's the external genital organ, and it's composed of the mons pubis, vaginal vestibule. It's contained of the labia majora and labia minora. It contains the vestibular, the major vestibular gland, or glandula vestibularis majores. They are paired here. And also the bulbi vestibuli, or vestibular bulb, they are together with this clitoris, which compose of the glans clitoris and body clitoris and crura. They are part of the external female genital organ. As you see here in the frontal or coronal direction, the frontal, the uterus and uterine tube and ovary, they are embedded or they are covered by the duplication of the peritoneum, which is called, this ligament is called ligamentum latum uteri, or broad ligament, the English terminology. It's covering the uterus, is covering the fallopian tube, and it's covering the ovary. Here is the sagittal cross section through this structure, and you can see this uterus, which is covered by the ligamentum latum or broad ligament. That part of the broad ligament that is covering the uterus is called the perimetrium and mesometrium, they call it also, the place of the attachment. And the place that of the peritoneum that or ligamentum latum that is covering the ovary is called mesovarium. And finally here is the fallopian tube or uterine tube, and the place that is covered by the peritoneum is called the mesosalpinx. So mesosalpinx, the mesometrium, and the mesoovarium, the part of the ligamentum latum that is covered by the broad ligament or ligamentum latum, which is the duplication of the peritoneum. So here in this picture you can see the sagittal cross section of the female pelvic region, and in this case here is the anterior view. You can see the pubic bone, and here is the posterior view or posterior part, that it's the sacrum. So if you go from anterior behind the pubic bone, you can see the urinary bladder that we already in the urinary system we discussed, and here is the female urethra that it's open in the place of the external genital organ in the vaginal vestibule. And The other behind the urinary bladder, it's the uterus that it's here. We are going to discuss about the position of the uterus, also the normal position. After the uterus, here is the fallopian tube or the uterine tube, and here are infundibulum, and here is the ovary that is located. Here that we are going also to discuss the details. Here is the ligamentum teres uteri or round ligament of the uterus. And after the uterus is the vagina, which is the posterior fornix and anterior fornix is seen here. That is covering the vaginal portion of the cervix, and then the vagina is continue downward and forward, and it open to the ostium vagina or vaginal ostium, that in the place of the external genital, female genital. So behind of that it's the rectum, as you see that it's starting as a ampulla and then the anal canal. Around that is the internal sphincter and external sphincter, that it has three parts that already we discussed. And here there is a peritoneum, the Douglas pouch, the rectouterine pouch here. It's the deepest portion of the peritoneum or peritoneal cavity in the body, that we said that is accumulating the exudation or blood or any pathological fluid here. And the next pouch, it's the vesicouterine pouch here, that it's is not that much deep, that like a Douglas pouch, so vesicouterine pouch. And those are the pathway of the external iliac vessels that we discussed it before. So regarding the first part of the internal female genital organ, it's ovary. Ovary, as we said, it's identical and it's synonym with the testicle in male, because in male the testicle was producing sperm and also producing the hormone testosterone. In ovary is producing the ovum and also the hormones, the female hormones, that they are estrogen and progesterone. Ovary generally is considered as an intraperitoneal organ. The shape is almond shape, is ovoid shape, and from the side it's becoming a little bit widened. The shape of the ovary and the size of the ovary is really related highly to the functional state of the ovary, and also the age of the person or the female. But generally the size of the ovary we consider as 4 times 2 times than 1 centimeter. So it means that 4 centimeter times that 2 centimeter or 2 centimeter times the diameter or the width, it's 1 centimeter. The ovary is located almost vertically in its place that we are going to talk. Also, according to the consistency, it's very tough, and also via the examination, the gynecological examination, the ovary also is palpable. The size of the ovary, as we said, it's highly related to the age of the person. So the maximum size of the ovary is around the 20 years old, and then the surface of the ovary in newborn and in the puberty is smooth, and by the increasing the age, the surface of the ovary become shrink, and shrinkage is happening, and on the surface you will see fissures that is generally is called ovarium giratum, because there are some gyrus or fissures because of the shrinkage of the surface of the ovary. It can happen in this area. So this is about the surface that we said that in the younger people it's the smooth, and in older people it's the lobulated, or then in the older it's becoming shrinkage. So the place of the ovary that we said that is intraperitoneal organ is inside the duplication or of the peritoneum, which is a part of the ligamentum latum. It's called mesovarium. So this part of the ovary, that's why, which is the anterior part of the ovary, which is connected to the mesovarium. It's called the mesovarium margin that I'm going to discuss. And also the hilus of the ovary, it's the point of the entrance and exit of the ovarian vessel, and it's the same area at the area of the attachment of the mesovarium, which is here. It's the location of the hilus of the kidney, or hilum of the kidney, which is located posteriorly. So we are going to discuss about the anatomical position of the ovary, that it has two surfaces. One surface, the ovary, so this is the view, this is the view from the posterior side, so you are looking at the posterior side to the ovary. So here is anterior and here is the posterior. We have two surfaces, the medial surface of the ovary, that is the upper surface of the ovary, which is directed medially toward the inside of the pelvis, and the other side, which is the lateral surface, it's the surface that they are toward the wall of the pelvis. As we said, we have two margins. So one margin, which is located posteriorly, is called the mesovarian margin, or margo mesovaricus, and this is the anterior margin, and it's attached to the ligamentum latum, or broad ligament, and it's the place that is the mesovarium is located. And the other margin, which is free margin, is called margo liber, and it's the convex margin on the posterior surface, or posterior margin. It's named. So this is the opposite to the hilum of the ovary. So the free margin of the ovary is in the posterior side, and it's the opposite of the mesovaricus margin, which is located in the anterior side. Ovary has two extremities, or two poles. One pole, which is the lower pole, is called the extremitas uterina, or uterine pole, because it's related to the uterus, and the other upper part, or upper pole, it's extremitas tubaria, or tubal extremitas, or pole, which is related to the fallopian tube, or the uterine tube. The ovary has two ligaments that are very important. One ligament that is starting from the lower pole, it means that the uterine pole or extremity, and is attached to the cornu or horn of the uterus, is called the the proper ligament of the ovary, the proper ligament of the ovary. And the other ligament, which is here, you can see, and it's attaching or starting from the upper pole. It means that the extremitas tubaria, or tubal pole, and it's directed to the wall of the pelvis. It's called the suspensory ligament of the ovary, and this suspensory ligament of the ovary contains of the vessels, and ovarian vessels and ovarian vein, usually ovarian artery 1 and 2 ovarian vein we have. So this is about the ovary in the at the place the ovary in the nullipar. It means that in the person that they still they didn't have the delivery, so it's located in the peritoneal cavity, let's say, that is the place of this ovary for the newly par person. It's called ovarian fossa or fossa ovarica. This fossa ovarica is located between the external iliac vessels, which is located above this fossa, and internal iliac vessels, which is located below this fossa. And anteriorly, this ovarium then is connected or attached to the ligamentum latum or broad ligament. For the female that we have, they did the delivery, and they call it multipar. So the ovary is shifting, the place is shifting a little bit toward the posterior side, and in this case the position of the ovary is called the Claudian fossa or Claudian fossa, and this fossa and the position of the ovary, it's between the internal iliac artery or vessels, and which is located anterior to this fossa or ovary, and posterior to the ovary is sacrum. So in this case, the two position of the ovary in the iliac, in the ovarian fossa in nullipar, and Claudian fossa in multipar, it's explained, and the position of the ovary in newborn, it's located at the level of the iliac fossa, and usually after the first year of their life, the ovary will go caudally, and it's going to the lesser pelvis, and this is the all about the macroscopical view of the ovary. So regarding the structure of the ovary, so here is the cross section through the ovary, and in ovary, at the surface of the ovary, first of all, we can see a cover which is called tunica albugina, like we had it in the testicle also. It's the connective tissue under the epitel. And then the main structure of the ovary, we have two parts. One, which is here, this area is called the cortex, and the other is the deeper area, which is called medulla. The cortex of the ovary, here is the place of the hilus, that the vessels that are coming, as we said, that it's in the mesovarian margin is located. So at the cortex is composed of the very dense connective tissue of it's called stroma, they call it, and then inside the cortex we have follicles. Those are the follicles that I'm going to discuss, and they are growing, and the maturation is happening through the ovarian cyclus that I'm going to discuss. And then in the center we have the medulla, and medulla is composed of the very highly vascularized tissue, which is composed of the loose connective tissue, collagen fiber, and the smooth muscles. As I mentioned, at the cortex of the ovary, first of all, we have approximately 1 till 2 million perimordial follicles. Those are the perimordial follicles that it's located in the newborn ovary, and the number is approximately 1 till 2 million. But only approximately 450 follicles in the life of the person, it's become mature, and it's becoming growing, and it's becoming mature. So, and this ovulation or ovarian cyclus, it's changing from the left ovary 1 month and the right ovary 1 month, the other month it happening. So it's changing from the left and right in the normal condition. So as I said, in the cortex, we have approximately 1 till 2 million primordial follicles located in the cortex, but only 450 approximately number it become mature. So those follicles that you can see, here is the primordial follicles, then one of them it become mature, that it's called the primary follicles. Primary follicles, they call it that they are growing of the or the follicles or the primordial follicles, that they are growing and growing. Then we have the secondary follicles. The secondary follicles still it doesn't have any cavity inside, so that's why this cavity is called antral. So that's why they call it preantral follicles or secondary follicles. And these secondary follicles, by the growing and during the ovarian cycle around the 12 till 14 days, so inside the follicle it's producing a cavity which is called antrum, and inside the antrum there is a fluid which is called liquor, and that's why this is the tertiary follicle, or they call it vesical follicles or Graafian follicles. Those are the names. So whenever the follicles that they have the cavity, they call it the Graafian follicle or vesiculosis, or the folliculus vesiculosis. It's called because of this cavity. And of course, all of them they have inside this ova or ovum that they are inside this follicle. At the day of the 14th day of the ovarian cyclus, so this Graafian follicle or vesicular follicle, it become ruptured and the ovum is released. The ovum, when it's released, is composed around it. It has its layer that is called zona pellucida. It's the covering or capsule of the ovum. The size is approximately 120 till 150 micrometer. And also it's considered as the largest cells of the human body. And in this case, during the 14 days of the ovulation of the menstruation cycle, so this released ovum, it will be released and is catched by the infundibulum part of the uterine tube or fallopian tube that I'm going to discuss. So what will happen then when this vesicular or Graafian follicle is ruptured? So then after the ovarian cycle, which is the day of the 14th, it continue, and the remnant of this ruptured follicle, and also the part of the Techal cells of the ruptured follicle, so it's producing this structure which is called corpus luteum or yellow body. This corpus luteum is responsible for the production of the hormone which is called progesterone. And this corpus luteum, if the fertilization is happening, so this corpus luteum, it will be remaining intact, and then it's continue to produce the progesterone to the 3 till 4 months of the pregnancy. So that's why then it's called the corpus luteum graviditatis, or graviditatis, this is a Latin name. So this is the corpus luteum or yellow body during the pregnancy. But what will happen that if the fertilization it doesn't happen, so this corpus luteum near to the end of the ovarian cycle, so it's become degenerated, and the remnant of this corpus luteum, it's becoming the corpus albicans. So the corpus albicans, it's the degenerated part of the corpus luteum with some connective tissue replacement that is happening, and then it will be disappeared. So As you see in the ovarian cycle or cyclus, so when it's primordial, that is already is located and is producing newborn, and only one in each ovarian cycle, it become growing and growing, then they make the primary follicle that they have inside the ovum or ova. Then it's becoming mature like a secondary, and then the tertiary, because it's inside, it's producing the cavity, which is called antrum and fluid. So these mature follicles, they are producing a hormone which is called estrogen. So this estrogen is produced by these mature follicles, and it's approximately, this Graafian follicles is 15 till 20 nanometer, of course. So in this case, when it's ruptured at the ovarian cycle, the day 12 till 14, then the remnant is the corpus albicans that is responsible for the production of the progesterone that I said. And if the pregnancy or fertilization, it didn't happen, the corpus albicans, it will be produced. So it means that the corpus luteum, it's called the corpus luteum menstruationis, or menstruation corpus luteum, that then it's changing to the corpus albicans. So as we said, that the blood supply of the ovary is coming from the ovarian artery, from abdominal aorta. It's a paired artery, left and right, and the ovarian vein on the right side, it drains usually to the inferior vena cava, and the left side, it drains to the renal vein. The lymphatic drainage of the ovary, it's usually is drained to the lumbar lymph nodes, and because of the long distance between the ovary and the lumbar lymph nodes, so we have to be careful about the case of the carcinoma or cancer of the ovary. We have to be careful of this metastatic cells. The position of the ovary, the right ovary, is usually near to the appendix, the vermiform appendix, and the left ovary is usually located near to the colon sigmoidum or sigmoid colon. Here we have the female genital organ, and we are going to start with the ovary. Before we start, I just explained the structure that you are looking at. This is the uterus. This is the fundus of the uterus, the body, and the cervix that I'm going to discuss. Those are the horn of the uterus or cornu of the uterus, that the fallopian tube, it's coming laterally. It's directed laterally. This is the fallopian tube or uterine tube. And here is this is the rectum. So here is the posterior surface or intestinal surface of the uterus. So in this case, here is this pouch, the Douglas pouch or rectouterine pouch that you can see. Of course, the in front of the uterus is the urinary bladder, and this is another pouch here that you can see. It's the vesicouterine pouch. So this is the posterior side or intestinal surface, and here is the vesical surface because it's going to the urinary bladder or vesica urinaria. So the view that you are looking is the posterior view, and as I said, here is the fallopian tube, here is the fallopian tube, and ovary is located in the posterior side. So this structure that you can see here, it's the ligamentum latum or broad ligament that we said that is a duplication of the serous membrane or peritoneum that is covering the uterus, is covering the uterine tube and covering the ovary. So first of all, the ovary, as you see that the ovary is located in the posterior side here. It's the almond shape, as we said. The size is approximately 3 to 5 times the 2 till 3.5 centimeter, times that the thickness is around 1 till 1.5 centimeter, as you see here. It's intraperitoneal organ, and it's the main organ of the female or male gland of the female genital organ that is producing the hormones, estrogen and progesterone, and also is producing the ovum. For anatomical structure that we said, the ovary has two margins. One margin that is attaching to the part of this ligamentum latum or broad ligament here in this area is the posterior margin, which is called margo mesovaricus or mesovarian margin. That is located posteriorly and is attached to the place of the mesovarium. It's the attachment of the ligamentum latum to the posterior part of the ovary. And posterior margin that you can see here, it's free. It's the margo libera or free margin of the ovary. Then ovary has two surfaces. One surface which is toward the medial side of the pelvis is the medial surface, and is usually toward upward, and the other surface is the lateral surface, which is going toward the wall of the pelvis, which is directed toward inferiorly. Then we have two extremities or two poles. One extremity that is close to the uterus. Here is the uterine pole or uterine extremities, and the other extremity, which is toward the uterine tube or fallopian tube, it's the tubal extremities or tubal fold. Then the ovary, as we mentioned it, the weight of the ovary is approximately 7 till 10 gram. The surface of the ovary is smooth in the younger female, and after or by the age and after the delivery, it becomes some shrinkage on the surface of the ovary happening, and is ovarium giratus is called. So ovary has two ligaments. One ligament, which is here, is very important. This ligament is the proper ligament of the ovary here, which is attaching to the cornua or horn of the uterus. This is one ligament, the proper ligament of the ovary. And the other ligament of the ovary is the suspensory ligament of the ovary. And through the suspensory ligament of the ovary, passing the ovarian artery and as a rule, two ovarian vein. This place of the mesovarium or mesovarian margin, that is the place for the attachment of the mesovarium. There is a place which is called hilus or hilum of the ovary, and again it's the place of the exits of the vessels here in this area. So hilus is located in the posterior margin or the mesovaricus margin or mesovarian margin. And if I open the ovary, you can see the surface of the ovary here. It's covered by the tunica albuginea, and by opening it, you can see we have two structures you can distinguish. One is here on the surface, which are the follicles. You can see this cavity here and here and here. Those are the follicles that we mentioned it, that is starting as a primordial follicle, then the primary, secondary, and vesicular or Graafian follicles that they are growing, and then they are at the day of the 14 or 12 till 14 day of the menstruation cycle. So this Graafian follicle is ruptured and the ovum is released, and then the remnant is the corpus luteum, and if the gravity happen, and the fertilization is happening. So then the corpus luteum is remaining approximately 3 to 4 months and producing progesterone. If not, then it degenerates and it's changing to the corpus albicans. Then in the center of this ovarium, you can see highly vascularized tissue with the loose connective tissue, which is called medulla. And those are the structure that macroscopically you can see. The rest we already explained. So this is the ovary, and we said that the ovary, the localization is in the ovarian fossa or Claudian fossa that we already mentioned. So once more, you can see the position of the ovary in the place behind the ligamentum latum, and here is the posterior or intestinal surface. So this is all about the ovary. So next part after the ovary is fallopian tube or uterine tube, sometimes also is called oviduct. So this fallopian tube in one side or in one end, it's very near to the ovary, and the other side it's very close to the, or is open to the uterine cavity at the horn or cornua of the uterus. So the length of the fallopian tube is approximately 10 till 15 centimeter, is variable, and we have the several parts. One part, we have two ostium or two orifice. One orifice, which is here, it's the abdominal ostium of the uterine tube, which is open to the abdominal cavity, respectively to the peritoneal cavity. The other ostium is called uterine ostium, and uterine ostium is open to the uterine cavity that we are going to discuss. So, first part, as we said, of the uterine tube, it's the abdominal ostium or ostium abdominalis, tuba uterina. Then in the beginning of the uterine tube, you have this widening part, which is called infundibulum. Infundibulum, it's the funnel shape that it's starting or is located at the beginning of the uterine tube, at the near to the ovary. So that's why the ovum, when it's released, is catched by the infundibulum, thanks to these structures that they are called fimberia of the uterine tube. Fimberia, it's the finger-like process or appendage that of the infundibulum, that there are approximately 10, and one of them, it's very long, and it's called the ovarian fimberia. It's called, and it's attaching to the surface of the ovary. So the infundibulum is the first part that it contains the tubal fimberia. This is the finger-like, and the longest one, which is approximately 2 centimeters, it's going caudally toward the surface of the extending from the infundibulum to the surface of the ovary. After infundibulum, the lateral 2/3 of the tuba uterina or uterine tube, it's the widest part of the uterine tube, and it's called ampulla. This is the lateral, the most widest part of the 2/3 of the, or lateral 2/3 of the uterine tube. It is approximately, and it's continue and is followed with the narrow part, which is called the isthmus of the uterine tube, and this is the location in the medial third of the uterine tube. Then the next part is the part that the uterine tube is going through the wall of the uterus. That's why they call it the uterine part or intramural part. That it's the part of the tube which is located and it passing through the uterine wall. And then finally the uterine ostium. So this 10 till 15 centimeter, once more for recapitulation and summary, we have the abdominal ostium, then infundibulum, that it contains the tubal fimberia, and one of them it's very long, which is called the ovarian fimberia. Then it's the lateral 2/3 is called ampulla. This is the widest part of the tuba. Then the medial 1/3 is the narrowest part of the uterine tube. It's called the isthmus. Then is penetrating the wall of the uterine. It's called the uterine part of the uterine tube. And then finally the other opening, which is called the uterine ostium, that is open to the uterine cavity. So it clinically is important that for the fertilization, the ovum, when it's released by the ovary, it's catched by the infundibulum, and it's by the movement of the uterine tube, which is similar to the peristaltic movement of the intestine. It's very similar. So the ovum is going toward the uterine tube, and vice versa. The sperm that was entered through the vagina and the uterine cavity was going and was directed toward the place which is called ampulla. So the most important or most common place that the sperm is meeting with the ovum, it's at the ampullar part of the uterine tube, and then after fertilization, so then 4 till 5 days it's happening thanks to the folds that we have it inside the uterine tube, the longitudinal folds. Then this after the fertilization, so it's going toward the uterine cavity. So if the fertilization it didn't happen, so then in this case the ovum that was inside the uterine tube, it's going under the process of the autolysis or autolyzation. It means that it's disappeared. So this uterine tube, it's very close. It has a very close contact with the small intestine in the peritoneal cavity. And again, the right uterine tube, it's near to the appendix, and the left one is near to the sigmoid column. So the ovary and the uterine tube together, it has clinically a special terminology which is called adnexa of the uterus. So adnexa of the uterus, they are ovary and the uterine tube. That is the clinical terminology. Regarding the structure of the uterine tube, it has three layers. So the first layer, which is the mucous membrane or the mucosal layer, the middle layer is the smooth muscle, and the outer layer is peritoneum, that we said that it's covered by the mesosalpinx, is a part of the ligamentum latum or broad ligament. So this mucous membrane is composed of several folds. That this fold is usually directed longitudinally, and in this case it's helping for the movement of the sperm and ovum in both directions. and the epitel is the cylindrical or simple columnar epitel. Also another clinically is important if the fertilization is happening in the uterine tube, and of course the middle layer is the smooth muscle that we said, and the outer layer is peritoneum. So if the fertilization is happening inside the uterine tube and it didn't go then toward the uterine cavity, then it's the extrauterine pregnancy. It's happening that by the growing of this structure, then the uterine tube, or by growing of the embryo, so here it's the risk or very high risk of the rupture of the uterine tube, and in this case it's caused a massive bleeding inside the peritoneal cavity. So this is the extrauterine pregnancy that is not normal, because the embryo it must be nested inside the uterine cavity. So next part, it's the uterine tube or fallopian tube that you see here. It's coming as a paired organ of the female genital system, and it has, according to its pathway, the length is approximately 10 till 15 centimeter, and the diameter is variable in different parts, between the 4 millimeter till 1 millimeter in the isthmus, which is the narrowest part. So the part of the fallopian tube, if you consider, here we have the abdominal ostium, which is open to the peritoneal cavity in the abdomen, so that's why they call it abdominal ostium. And here this part is called infundibulum. The infundibulum, it's the place that it has a lot of finger-like process, which are called fimberia. And one of the fimberia, which is largest, that is going to the ovary, is called the ovarian fimberia. The other is the tubal fimberia, that they are approximately 10 till 12 finger-like process. And only we have one ovarian fimberia that is coming toward the ovary. So this part of the infundibulum, it's continue with this widening part, which is the lateral 2/3 of the length of the fallopian tube. It's called the ampulla. Is the widest part of the uterine tube, together with the infundibulum. And then when you go medially toward the corner or the horn of the or cornua of the uterus, the medial 1/3, which is becoming narrow, and this is the narrowest part of the uterine tube, is called the isthmus of the uterine tube. And then here finally it continued through the wall of the uterus, is called uterine part, and then finally is opening inside the uterine cavity as a uterine ostium or opening. So those are the part of the fallopian tube. Once more, you can see here the fallopian tube is attached to the ligamentum latum, and this place of the attachment is called mesosalpinx. The attachment of the mesentery of the uterine tube, which is called mesosalpinx, is the place for the attachment. So here you can see again the fallopian tube, the structure. We said it already in the theory. Next part of the female genital organ is uterus. Uterus is a hollow organ, and it has a very strong muscular structure, and it's covered by the peritoneum, as we mentioned it, the duplication of the peritoneum, which is called broad ligament or ligamentum latum, that the part that is covering the uterus is called mesometrium. Uterus has the size approximately 7 till 9 centimeter in the direction of the superior and inferior, and in the direction of the lateral and medial direction it's 4 till 4.5 centimeter, and the diameter is approximately is 2.5 till 3 centimeters. So this is the size of the uterus, and of course the uterus during to the pregnancy, the size and also the weight, it's several times it's increasing. So regarding the parts, and the main part of the uterus, which is the shape of the uterus, looks like a pear shape, and it's going downward, and it's continue with the vagina. So the orifice of the uterus, it's open to the cavity of the vagina. Generally, we recognize the three main parts of the uterus. The first part, which is the cranial and the widest part of the uterus, is called body. Then the second part is this part, which is called the isthmus, that it's located between the body, and the third part, which is called the cervix. So this is the isthmus and the narrowest part. And then here is the cervix of the uterus, which is the most inferior and narrow part of the uterus, which is called cervix. So these three main parts, the body, the isthmus, and the cervix of the uterus, there are the three main parts. The isthmus is the place between the body and the cervix, and the length is approximately 1 centimeter. The uterus has wide in the direction of anteroposterior direction, and is located inside the lesser pelvis. And as we mentioned it, that the cervical part of the uterus, it has, we are going to discuss, it has two parts, and according to the position of the vagina. So this part of the uterus that is not covered by the vagina is called the supravaginal portion of the cervix of the uterus, and this part of the cervix, which is covered by the fornix of the vagina, is called the vaginal portion of the uterus. The cervix in nullipar, or in a person that still didn't or she didn't have delivery, in the supravaginal part is usually the cylindrical, but the supravaginal part is usually the cylindrical, and the vaginal portion was usually the conical. But after the birth, so it means that in multipar person, or for the females that they have already they did the delivery of the baby, so both parts, the supravaginal and the vaginal portion of the cervix, they are looks like a cylindrical. So this is a part. So then another part that you can find it in the uterus is this part, which is called the fundus. It's the dome shape of the uterus above the point that the uterine tube is enter to the enter to the uterus. So this cranial part is called the fundus. That normally the fundus it didn't reach above the level of the symphysis pubis. So the fundus it's at the under the level of the superior margin of the symphysis pubis is located. Then the next part is here, which is called cornua or cornu of the uterus or horn of the uterus. And this horn or cornua of the uterus is the place for the passage of the tree structure. One structure that already we mentioned it, that the uterine tube is entering to the uterine cavity through the place which is called horn or cornu. The other is the place for the attachment of the ligamentum latum, as we mentioned it, broad ligament. It's from the cornu. It's going in the direction of the laterally first, and then it continue toward the ventral direction. So this is the broad ligament, and then the part in the side of the uterus. This part is called the margin of the uterus. The margin of the uterus, we have the right and left margin of the uterus. That is important. And it has two surfaces, the uterus, the one surface which is the posterior surface, or this surface which is ventral and caudal surface is called vesical surface, because this is the anterior inferior surface which is facing the urinary bladder, and the other surface is called intestinal or intestinal surface, which is located posteriorly and superiorly and in contact with the sternum. So those are the part of the uterus. And finally, the uterine ostium is the place that the uterus is open toward the vagina, and in nullipar again this orifice is round shape, and in multipal, or the lady or the female that she did the delivery of the baby, it's like a slit-like after the parturition. So it's the macroscopical view of the uterus. So once more for the recapitulation, we have the three part of the uterus, which is the body, which is the most wider cranial part, then the isthmus, which is here, and then the cervix, which is here. The cranial part of the body above the entrance of the uterine tube, this part is called the fundus. Then is horn or cornu of the uterus, which are the place of the entrance of the uterine tube, the place of the attachment of the ligamentum latum, and the third structure that they are attaching to the cornu or the horn of the uterus that I didn't mention it, and it's important, is the ligamentum teres uteri, is a round ligament of the uterus that is from the cornua, it's directed downward, and it's attaching to the labia majora in the external genital female, the external female genital part. Then the transition place between the body and the cervix, it's the isthmus. As we said, it has approximately the length approximately 1 centimeter, and then the cervix that we said that we divide them to the two parts. The part that is not covered by the vagina is called supravaginal portion, and the part that is covered by the vagina in here and here by the anterior and posterior fornix of the vagina and the lateral fornixes of the vagina, or partes lateralis. So it's called the portio vaginalis, or vaginal portion of the uterus. Regarding and finally we said that it's the uterine ostium that is open to the vagina. Regarding the cavity of the uterus, it's as you see, is the triangular shape. The widest part it's in the body, and it's anteroposteriorly it's becoming very wide, And the narrowest part is the isthmus canal. So this is the isthmus canal. We said that is approximately 1 centimeter. And then another part is the cervical canal. The cervical canal here, it's starting from the end part of the isthmus canal, and then it's ending toward the uterine ostium that we already mentioned it. This ostium or uterine ostium that I mentioned it here, that it's in the nullipar, it's rounded, and multipar is the slit-like, transversally directed. It's bordered by the two parts. One is anterior lip, and the other is posterior lip, or labium anterior or labium inferior. So, as we mentioned it, that this cavity of the uterus is the anteroposteriorly is becoming enlarged and is triangular shape, and at the level of the cervix, we have the cervical mucosal fold that is arranged like leaves of the palm tree. So that's why they call it plica palmate or plitze palmate. It's the palmate folds of that you can find it only at the place of the cervix or cervical canal. And then finally this PME that you can find it, it's the layer of the uterus that I'm going to discuss. The E is endometrium, the most inner layer. M is the myometrium, the strongest layer of the uterus, which is 1.5 centimeter approximately. It has a thickness. And finally P is perimetrium. It's the serous layer that is covering the uterus, which is the peritoneum, and it has a name which is called perimetrium. So endometrium, myometrium, and perimetrium that I'm going to discuss. Here is the sagittal section of through the uterus and vagina, and this is the view from the left side. Regarding the part of the uterus, I already mentioned, and you know it. But what I wanted to say here, and is very important, it's the physiological position of the uterus. We have two physiological position of the uterus. One is called anteversion, and the other is called anteflexion. Anteversion is the axis of the position of the uterus when the fundus a little bit is backward, and there is the axis of the whole uterus, with the axis of the vagina. They make the angle which is approximately 90 degrees, and this position is called anteversion of the position of the uterus, and is the normal physiological position of the uterus. The other position that is also normal and physiological position of the uterus is called anteflexion of the uterus. Anteflexion of the uterus is the angle between the axis of the body of the uterus with the angle that the angle between the axis of the body of the uterus with the axis that it's passing through the cervix of the uterus at the level of the isthmus. So it means this angle at the level of the isthmus, which is approximately 90 till 150 degree, it's called anteflexion. And these two positions, it's really depend on and it's influenced by here, as we said, it's the urinary bladder. If the urinary bladder is full, so it's pressing the uterus backward, and also the content of the rectum, because here is the rectum and the intestine. So if they are full, so they can push the uterus also toward the forward direction. So in this case, be careful of these two positions of the uterus, the anteflexion, which is the angle between the axis of the body and axis of the cervix at the level of the isthmus, and the anteversion, which is the axis of the whole uterus with the axis of the vagina. So it's the anteversion, and both of them the physiological and normal position of the uterus. So another important that I already mentioned it, and it's important, is the layer of the uterus. The layer of the uterus, we have three, as already I said. The inner layer is the endometrium, then the middle layer is myometrium, and the outer layer is perimetrium. The endometrium, it's the color, if you look at it, so it's approximately is grayish and pinkish color it has, and it composed of the epithel, which is the cylindrical epithel it has. Be careful, the cylindrical epithel at the level of the vaginal portion of the cervix, it's changing, clinically very important, and it's changing to the squamous epithel. And this place that the cylindrical epithel, it's changing to the squamous epithel, it's very important, it's called the ectopic place, and usually, as we said it also before, whenever the epithel is from one kind of the epithel, it's changing to the other kind of the epithel, so it's danger of the dysplasia and changing to the cancer. So that's why the most of the cancer at this of the uterus is happening at the vaginal portion and in this ectopic place of the uterus. So this is one clinically. Another, regarding the endometrium of the uterus, we have two layers. One layer which is changing during to the menstruation cycle, and it's mainly superficially is called the functional zone. The functional zone, it's the part of the endometrium that during to the menstruation cycle is changing. And the other one that is a deeper layer, and it's located in deep to the functional zone, is called basal zones. Basal zones of the endometrium, it doesn't change during to the menstruation cycle, and in this case it's just doesn't change, and it's producing and regenerating the new zone for the functional zone on the superficial part. So two parts. Another clinically important is that this functional zone, it doesn't change, or during to the menstruation cycle, the cervix of the uterus, it doesn't go under the changes. So this is also important. So the cervix during to the menstruation cycle, it doesn't go under some changing. So endometrium of the cervix, it doesn't change during to the cycle, the menstruation cycle. Then another important thing, it's in the endometrium we have some glands that they are called the uterine glands, and also inside we have some folds in the cervical region, as I mentioned it here. So only here that we have the plica palmata or plica palmata, which is the fold in the cervical canal, and it looks like leaves of the palm tree. Then this gland, the uterine gland that is located in the endometrium, it means the inner layer, it's producing is a mucinous gland, and they are producing the alkaline mucosa, and this alkaline mucosa has a function that it's preventing the infection of the uterus. So it's preventing the entrance of the infection to inside the uterus. So this is one thing, and also clinically is important that if these ducts of this uterine gland, with any reason, it's become obstructed, and it's closed, so that's why it's producing inside the uterus some cyst that is common also. It's called retention cyst or Naboth, if I am correct with the pronunciation, or Naboth cysts, or they are generally that as a retention cyst. It's also clinically important due to the obstruction of the ducts of this gland in this area of the endometrium. Then the second layer or the middle layer is myometrium. The myometrium of the uterus, it has the strongest layer of the uterus, and approximately 1 till 1.5 centimeter. And this is the most strongest layer of the myometrium. You can find it in the body, and the weakest part is in the cervix of the uterus. So the muscular layer, the myometrium, according to the direction of the fiber, the smooth muscle of the fiber, and the vascularization, we divide them to the 4 parts, from the inner surface till the outer surface. The 4 part of the muscular layer or myometrium, we have it. One is stratum submucosa or submucosal layer, which is composed of the longitudinal muscle. The other layer is called vascular layer, which is the layer that is very highly vascularized. And then the third layer is called the stratum supravasculare, which is the supravascular layer, and it's mainly composed of the circular fiber. And finally, the stratum subserosum or the subserosal layer, which is mainly composed of the longitudinal muscle. So 4 layers of the myocardium: the submucosal, vascular, supravascular, and subserosal from inner to outer. Also, it's important to know it. That is longitudinal, vascularized, circular, and longitudinal layer respectively. And as we mentioned it also here again and again, the uterus is covered by the peritoneum, the ligament, the broad ligament, which is frontally is directed, and the part of the broad ligament that is covering the uterus is called mesometrium. It's covering the uterine tube is called mesosalpinx, and it's covering the ovary is called the mesovarium. And as you see here in this picture, why I choose this picture is that this green line, it's the peritoneum, and it's the outer layer of and is forming the outer layer of the uterus, which is called perimetrium. Be careful of the terminology, perimetrium. And this peritoneum, it's covering all part of the uterus except the vaginal portion of the uterus, and also the anterior part of the cervix of the uterus. So on the anterior wall of the cervix of the uterus, these 2 exceptions, they are the only part that they are not covering the covered by the peritoneum. So as you see, the peritoneum as a vesicouterine pouch here is finishing. So this part of the uterus in anterior surface, it's not covered by the peritoneum. And posteriorly, as you see, the Douglas pouch, it's going deeper, and it reached to the posterior fornix of the vagina, which is higher, approximately 2 centimeters than the anterior fornix, and it reached till the level of the posterior fornix of the vagina, and in this case, this Douglas pouch also. It's palpable via the vaginal examination. This is also the clinically important that it's palpable in this area. So this is the perimetrium, and this is the this is the relation of this three layer regarding to this layer of the uterus. Next part is the uterus. As you see here, the size of the uterus is variable, but the normal size of the uterus is approximately 7 till 9 centimeter times that 4 till 4.5 centimeter times that the thickness is approximately 2.5 till 3 centimeter. The uterus, as we mentioned, it is covered by this part of the serous membrane. The application is called broad ligament or ligamentum latum, which is the place of the attachment is called mesometrium, and it's starting from the lateral margin and it's of the uterus, and then it's continue forward. The part of the uterus, we had three parts: the body of the uterus, then the isthmus of the uterus, and then its cervix of the uterus that I'm going to discuss. The superior part of the body, this dome-shaped structure is called the fundus of the uterus. Then it's fundus, which is the place above the corner or the cornua or horn of the uterus. That, as we mentioned, three structure is passing: the fallopian tube or uterine tube, the proper ligament of the ovary, and one ligament which is here is missing is the round ligament of the uterus or ligamentum teres uteri. The three structure that they are connecting to the horn or cornu of the uterus. Then it's the body, and we have two margin, the left and right margin of the uterus, and then here is the narrow part, which is the transitional place between the body and the cervix. It's called isthmus. Is the narrow. The height is approximately 1 centimeter, and then we start with the cervix or the neck of the uterus. The cervix or neck of the uterus, if you look at it, we divide them to two parts. This part, this is the vagina, as you see, and this is the end of the uterus, which is called uterine ostium or uterine os, they call it. And we said that is in nullipar, it's rounded, and after the giving the birth, so is the slit-like transverse fissure. You can have this part. So the cervix, this part of the cervix that it's covered by the vagina as a anterior fornix, and the posterior fornix is called the vaginal portion of the cervix, that you can see vaginal portion of the cervix here. And above that, till the level of the isthmus, it's the supravaginal portion of the cervix. So as we mentioned it before, the anterior fornix is approximately 2 centimeter lower than the posterior fornix, and in this case the posterior wall of the vagina is approximately 10 till 11 centimeter, and anterior wall 8 till 9 centimeter. Then, as we mentioned it, the uterus has two surfaces, the superior and posterior surface, which is toward the rectum and intestine. It's the intestinal surface here. So this is the view from the posterior side, and here is the anterior and inferior surface, which is toward the urinary bladder, which is called the vesical surface, because it's toward the vesica urinaria. So these are the macroscopical part of the uterus, and I'm going to show you the details of the inside. So here is the other preparation of the uterus. Here again is the fundus, here is the body, here is the isthmus, and here is the cervix. The cornua or horn of the uterus, which is fallopian tube, as you see, and here is the ovary. and again here is the proper ligament of the ovary, and there is the suspensory ligament of the ovary, which is attaching to the other side. And here it's the widening part of the fallopian tube, which is called ampulla, is followed here as an infundibulum, and here is followed medially as an isthmus. What I wanted to show you, if I turn it and I open the cavity of the uterus, you can see the cavity of the uterus has a triangular shape. The base is located at the fundus, and the corners, they are in the horn or cornua of the uterus here. Anteroposteriorly is becoming wide, and whenever we are going toward the isthmus, so it's becoming narrow. So here is the uterine cavity. Then when we are going to the isthmus, here is the narrow canal, which is called isthmus canal or canal of isthmus. And then it's continue, if I open, so then it continue as a cervical or the cervical canal, which is here. You can see here cervical canal, and I don't know if you can see the in the cervical canal is the only place that you can see some folds, which are called the palmate folds. The mucosal folds, that they are called palmate folds, that is here is located, and then it continue with the uterine ostium, which is opening to the vagina. And here you can see the wall of the vagina here. And the wall of the vagina, it's covering the portion of the cervix, which is called the vaginal portion, and above that it's the supravaginal portion of the uterus. Here is again another preparation. So this is the fundus, this is the body, this is the horn of the uterus. Those are the this is the isthmus, and then is followed by the cervix. This is the vagina that I'm going to discuss, but here you can see very nice the passage of the fallopian tube, and you can compare the widening part, which is the ampulla, which is usually the fertilization is happening in this area, and then here is the narrow place, which is called isthmus, the medial 1/3. And here there are the infundibulum or infundibulum, and it has this finger-like process that it's on the part of the infundibulum is located. And here is the other side. You can see these processes very nicely. The tubal fimberia, and one of them, which is the longest, which is the ovarian fimberia. Here is the position of the uterus. Again, you are looking at it from the posterior side. Here is the mesovarian margin. Here is the libero, and then here is the extremitas or pole, the uterine pole, and here is the tubal pole or extremities. And here it's the vagina. So if you open the vagina, so here you can see the ostium of the uterus, and here it's the two fornix of the vagina, which is the posterior fornix and anterior fornix. The posterior fornix, it's deeper till the level of the Douglas pouch. It's reached the anterior part. It's lower, or it's not that much the length. It's 2 centimeters smaller, and this anterior surface of the cervix and uterus, it's not covered by the peritoneum. The rest of the uterus, it's covered by the peritoneum. The only part is the anterior surface of the uterus and cervix is not covered by the peritoneum. So here is the other preparation. This is the uterine ostium that I said that after the giving the birth or delivery, so it will not be a round shape, but it's like a slit, like a transverse fissure or opening. It's happening and is making the tulip, the anterior lip and posterior lip, and it's covered by the vaginal fornix. The fornix is the anterior part and posterior part, and the lateral part, the partes lateralis, is the part of the fornix of the vagina. So what you are looking at is the uterus of the pregnant woman. That, as I mentioned, during the pregnancy, the size of the uterus, it's several times is becoming bigger and enlarged, and also the weight of the uterus, in this case, it become enlarged, as you see. But still, here you can see the structure, the fallopian tube, the fimberia, infundibulum, the ampulla, and the isthmus, which is located here in the posterior part of the ligamentum latum. Here is the attachment of the ovary, here is the mesovaricus margin, and here is the margo libera. It's located, those are the remnant of the broad ligament here, and here hits the vagina, the portio vaginalis or vaginal portion of the cervix here, and here is the round shape ostium uteri or the uterine ostium here, and this enlargement. If I look at it, if I turn it, so you can see this enlargement of the cavity of the uterus is thanks to the influence of the hormones. So it's making the size of the uterus for the several times bigger and bigger size. This is the cross section through the wall of the uterus, through the body of the uterus, and you can see at the wall of the uterus, you can see these structures here, and here. Those are, of course, they are not normal. Those are the abnormal pathological structures. So those are the tumor, most probably the benign tumor of the uterus, because it's very well circumscribed and it's bordered here, and easily you can separate it from the wall. So those are the if it is arising from the smooth muscle or myometrium, so it can be myoma. It's the cancer. It's the tumor of the uterus. So this is also an interesting case that I wanted to show you here. So here is the picture that is showing the normal physiological position of the uterus. Here in this picture, you can see the anteflexion position, which is, as we said, that the axis of the body. It's at the level of the isthmus, is making the angle with the axis of the cervix. So in this case, as you see, the body of the uterus and the cervix of the uterus, they are inclined anteriorly here, and in this case you can see the angle here, which is anteflexion, which is approximately 90 till 150 degree. And here is vice versa. It's the angle, it's the anteversion. In anteversion position, you see that the axis that it's mainly is passing through the isthmus toward the axis that it's passing through the vagina. It's making an angle which is called anteversion, and in this anteversion position, which is 90 degree, you see that the fundus and the body of the uterus is going anteriorly, but the cervix it's going more posteriorly toward the posterior fornix of the vagina. So here, these two, the anteflexion and anteversion, they are the two examples of the normal physiological position of the uterus. So this is the cross section through the pelvis, and you can see the organs inside the pelvis. So here is the urinary bladder located anteriorly, so it means that here it's the symphysis pubis or pubic bone. Behind that is the uterus here, which is followed by the vagina. And here is finally the sigmoid colon, which is followed by the rectum and then the anal canal. So if you consider here between the uterus and the rectum, there is a pouch here again and again, the Douglas pouch or the recto-uterine pouch here, the deepest part of the peritoneal cavity in female here. And the other pouch in female is between the vesica urinaria, which is the urinary bladder, and uterus is called the vesico-uterine pouch here. Here you can see the wall of the urinary bladder, again that it's folded except the triangle, the vesical triangle. Here is the female urethra, which we said that it has 3 till 4 centimeter, and it's opening here as an external urethral orifice, approximately 2 centimeter behind the glans clitoris. And behind that, here you can see the wall of the vagina. So again, you can see that the anterior wall, it's the shorter, around this 8 till 9 centimeter, and the posterior wall is longer, 2 centimeter longer, around 10 till 11 centimeter. And in this case, here, this area, it's the fornix, the posterior fornix, and here is the anterior fornix. And this area of the uterus is the vaginal portion of the uterus. So the wall of the vagina, as you see here, it has some rugae or vaginal rugae, the transverse fold that they are making the clone. And here it's at the external genital part, it's opening as a vaginal ostium in the place which is called vaginal vestibule. And here finally it's the posterior side, which is the opening of the anal canal, which is the anus, and between them there is a septum, which is called the recto-vaginal septum here, which is somehow separating the vagina from the rectum, and it's attaching to the perineum. So this is the sagittal cross section that you will see the organs of the pelvis. This structure that you are looking at is the placenta. The placenta is the temporary fetal organ that begins developing from the blastocytes shortly after the fertilization and after the implantation. And it has a very critical role for the carrying the blood supply. It means the oxygen and nutrition to the baby from the mother to the placenta, and from the placenta to the baby, and vast material from the baby toward the mother's blood. It's the name of the placenta is arising from the type of the cake. So it's it looks like microscopically is the flat, and it's directed or is attached or is connected one side via this umbilical cord to the fetal or fetus, and the other is attaching to the wall of the uterus. So this umbilical cord, inside the umbilical cord, it's 3 vessels is located. It's one vein that is carrying the oxygen and nutrient from the maternal blood to the baby or to the fetus, and it has two arteries that they are carrying the unwanted material from the baby toward to the platysma and then toward to the mother's blood. So this is the placenta that is after the delivery. It will be also removed from the body. Another important thing about the uterus is the fixation of the uterus. The structure that they are fixing the uterus in its position, in normal position, which is anteflexion and anteversion. So those are the collective of the connective tissue that they are fixing the uterus in its position, and the most important place for the fixation of the uterus is at the cervix of the uterus, and less connective tissue that they are playing role for the fixative of the uterus is at the level of the fundus of the uterus. So the most of the ligaments that they are attaching and they are fixing the uterus, they are attaching to the cervix of the uterus. So this collective of this connective tissue that they are fixing the uterus in its position, it has a specific terminology which is called parametrium. Parametrium. Be careful not to do mistake with the perimetrium, that it was a serous layer, the outer serous layer of the uterus, which is a peritoneum and is covering the outermost layer of the uterus. But this terminology for these ligaments that they are fixing the uterus is called parametrium, and this parametrium connective tissue or ligaments, they are passing through the loose connective tissue around the uterus, which is called parametrium, and these ligaments that are called parametrial ligaments. And these ligaments, they are passing between the myometrium and perimetrium. It means between the middle layer and the outer layer of the uterus they are passing. The first and the most important ligament, here you can see the cross-section of the parametrial ligaments. This is the view from the above toward the pelvic region here. In this case, here is the pubic bone, and here is the sacrum, and here there are the ilium that they are bordering the entrance to the pelvis. Here anteriorly behind the symphysis pubis is the urinary bladder. Behind the urinary bladder we said that is uterus, and behind the uterus is rectum. So from anterior to the posterior is urinary bladder, uterus, and rectum. So the most important parametrial ligament that it's attaching to the cervix of the uterus is this ligament. It is very important. It's called cardinal ligament or uterine cardinal ligament or transverse ligament of the uterus. This ligament, it's coming from the neck or the cervix of the uterus, and it's going to the wall of the lesser pelvis here and here, and it's allowing the uterus to do the movement toward the position of the anteversion and retroversion. So it's moving anteriorly and posteriorly, and this is the most important and the most effective ligament for fixation of the uterus. Then the next ligament is this ligament, which is called the sacrouterine ligament or ligamentum sacrouterina. This is the strong ligament which is starting from the sacrum, as its name is arising, and is attaching to the cervix of the uterus. Mainly, it's going parallel with the wall of the rectum, and then it's attaching to the uterus. And this is also, it's fixing the uterus in the anteversion and anteflexion. Its position is in the normal or fixative role for the uterus is playing. Then we have the ligament which is connecting the urinary bladder to the uterus. Is called the vesicouterine ligament. This is the not as strong as sacrouterine ligament. It's a little bit weaker, but it's coming from the urinary bladder, and it's going and toward the uterus. And also this ligament which is attaching to the urinary bladder and continue as a vesicouterine is called pubovesical ligament. Again, it's the sagittal is going parallel with the urinary bladder and is attaching to the uterus. So in this picture you can see parametrial ligaments, the most important, the cardinal here and here, the sacrouterine here and here, and the vesicouterine and pubovesical ligament. There is one ligament which is in this picture is not shown, and it's important ligament, and it's called ligamentum teres uteri, or round ligament of the uterus. This is the ligament that is originating from the horn or the cornu of the uterus. It's passing through the inguinal canal in female. In male we had the ductus deferens that they were passing through the inguinal canal. In female we have the ligamentum teres uteri, or round ligament. Then it's attaching and it goes to the connective tissue at the labium major, or the labia majora, and this ligament is keeping the uterus in anteversion and anteflexion position. So this is the ligament of the tres ligament, which is not attaching to the cervix. Practically, it's going to it's attaching to the horn or the cornua of the uterus. So this is the parametrial connective tissue and the parametrial ligament and parametrium. In addition of these ligaments, there are some supporting muscles also that they are supporting and somehow fixing the uterus in its position, and they are the pelvic diaphragm and the urogenital diaphragm. The pelvic diaphragm is made by levator ani muscle and musculus coccygeus, and the diaphragma urogenitale, or the urogenital diaphragm, is made by the deep transverse perineal muscle. Sometimes also they say also the superficial transverse perineal muscle plus the external urethral muscle. They are making the urogenital diaphragm. In the anterior part of the levator ani muscle, which is make the main part of the pelvic diaphragm, we have the opening which is called the urogenital diaphragm, and through this urogenital diaphragm it passes the urethra and vagina, and around the wall of the vagina there is a muscle which is called pubovaginal muscle, or musculus pubovaginalis. It's going toward the vagina, and it's attaching to the cervix of the uterus, and in this case they are playing role for the fixation of the uterus as well, this pubovaginal muscle. And also to the urogenital hiatus from the inferior side, Also there are some connective tissue and some smooth muscles of the diaphragm, urogenital diaphragm. So those are about the fixative or fixation of the uterus. So very important is the lymphatic drainage of the uterus. Different part of the uterus, it has different part of the different lymphatic drainage. We are going to start about from the cervix of the uterus. The cervix of the uterus, the lymphatic drainage, it goes to the lymphatic external iliac lymph nodes and internal iliac lymph nodes. As I mentioned it before, approximately 2 centimeters from the cervix of the uterus, where the ureter is crossing under the uterine artery. So there is a Bayer's lymph node, which is part of the parauterine lymph nodes, and the clinically is very important. And finally, it's draining to the sacral lymph node. The lymph node from the lower part of the body or corpus, and it's draining to the external lymphatic lymph nodes, and from the upper part of the body, including the fundus, it's going parallel with the ovarian vessels to the lumbar lymph node, and from the region of the cornu or the horn of the uterus, parallel with the round ligament of the uterus or ligamentum teres uteri, it draining to the superficial inguinal lymph node. So different part of the uterus, different drainage, and is very important. Next part of the female genital organ is vagina. Vagina, as we know, it's the organ, the Greek word for the vagina is kolpos. It's the unpaired organ which is anteroposteriorly, it's becoming enlarged and flat, and it contains of the connective tissue and smooth muscle and some mucous membrane. The vagina, the function of the vagina, you know that it's playing role for the pathway, the sexual pathway and copulation organ. It's the pathway for the exiting of the menstruation blood, and also this is the normal physiological pathway for the giving birth of the child through the vagina. So that's why the structure of the vagina is very flexible, and it's very extendable, so it's able to extend very easily. The vagina, we said that it's end up to the ostium, which is called vaginal ostium, which is this ostium is placed to the place between the labia minora of the external genital organ, female genital organ, and between this labia minora there is a place which is called the vaginal vestibule, and this is the remnant of this vaginal vestibule is the remnant of the embryologic of the sinus urogenitalis or urogenital sinus. So as we said that it's anteroposteriorly, it's becoming wide and flat, this vagina. The vagina has, in this case, the anterior wall, they call it parius anterior, which is approximately 8 till 9 centimeter is the length of this vagina, and we have the longer posterior wall or parius posterior, which is from approximately in the length of the 2 centimeter longer than the anterior wall. So it means that the posterior wall is approximately 10 till 11 centimeter, or anterior wall it's shorter than the posterior wall. So the parius anterior and parius posterior. So toward the vaginal portion of the uterus, the vagina, it's making a structure which is called fornix, and this fornix is divided in anterior side, the anterior fornix of the vagina, and the posterior fornix of the vagina and posterior side, and also in both sides also we have the partes lateralis, or lateral parts of the vaginal fornix as well. So the posterior fornix and anterior fornix and the lateral part of the vaginal fornix in both sides. So as I mentioned, the posterior fornix is much more deeper and it's higher, is located, and it has a close relationship with the Douglas pouch or the recto-uterine pouch, and in this case you can do the examination of this pouch also. So in this case the most deepest part of the vagina is in this area, and it's in the posterior fornix, and that's why this part is called, the Latin name is called the receptaculum seminis. Is the deepest portion of the vagina at the posterior fornix. So as you see in this cross section of the vagina, you can see the fold here that they are making, they call it the vaginal rugae. Vaginal rugae, they are the transverse fold of the mucous membrane that they are projecting, or transverse ridge that they are projecting from the epithelial and supporting tissue of the vagina in anterior wall and in posterior wall, or parius anterior and parius posterior. Here you can see, and here in the anterior side, and here is the posterior side, and in both sides you can see that they are making the column, the longitudinal column that is called the vaginal column, that is the anterior vaginal column, or the column of the rugae, and the posterior column of the rugae of here in the posterior wall, that they are located inside the wall of the vagina. So in the structure of the vagina, as I mentioned it, that the vagina is passing through the opening of the levator ani muscle at the urogenital, at the pelvic diaphragm, which is called urogenital hiatus, and it's from the side is attached, or is surrounded by the muscle which is called pubovaginalis muscle, that is very important muscle that we already mentioned it. Also the vagina inside, according to the structure of the vagina, so we have 3 layers. That first layer is the mucous membrane, and second layer is the smooth muscle, and the third layer is the adventitia. So it's not peritoneum, but is adventitia that is covering the vagina. At the surface, or the mucous membrane of the vagina, we don't have any glands. This is interesting, but vagina has the secret, and this secretion of the vagina is after the sexual stimulation. So it's produced from the transsudate, from the vessels, and they are located in the lamina propria of the mucosa, so they don't have the normal structure of the glands, but they have this secret that it's helping, and it's produced generally after the sexual stimulation. So this is the important things about the macroscopically of the vagina, which is important to know. And between the vagina posteriorly we have the rectum, and between the rectum and the posterior part of the vagina we have the septum, which is called the rectovaginal septum, that is directed inferiorly, and it reaches to the centrum perineum. So is the connective tissue in the perineal region, which is called septum perineum. This is also important, the posterior relationship of the vagina. Regarding the ostium of the vagina, in this area that I said, this is the vaginal ostium, which is located in the vaginal vestibule, in the area between the labia minora. Here it's important that we have a duplication of the mucous membrane plus a very small part of the connective tissue, which is called the hymen in this area, which is very important for forensic medicine. This hymen that it's covering the vaginal ostium. It's, as I said, is formed by the duplication of the mucous membrane plus a little bit of the connective tissue plate, and it's called the hymen or hymen. And this hymen is, in normal case, it can have some perforation, and this small perforation, the most common perforation, it's happening as a round shape opening in the middle of the hymen, which is called the hymen annularis. This hymen annularis, it happening it's existing for the person who doesn't have, or she didn't have any sexual activity through this hymen. So this hymen is intact, and in this case it's called hymen annularis, with this small perforation in the center of this hymen. After the first sexual activity, so this part of the hymen, it will not be intact. It will be destroyed, and in this case we are using the terminology of the defloration. So hymen defloration is after the sexual activity. It's appearing that it's ruptured, this hymen. And also we have another terminology, the lady that they are giving birth after the delivery of the baby. So the shape of the hymen, or the shape of this mucous duplication, it's becoming a lobulated or ball-shaped structure, which is called caruncula hymenalis, or caruncle, which is important. So this three shape for the lady that or for the female that she doesn't have sexual activity, hymen annularis. After the first sexual activity, hymen defloration or defloratus. And after the giving the birth, it's the hymen or caruncula hymenalis. It's very important in forensic medicine to determine if it was the sexual activity happened or if this body it gave delivered the baby or they giving the birth, so all of them they are important according to the forensic medicine. Finally, we have the external female genital organ. The external female genital organ generally has a terminology as a pudendum or pudendum femininum, and the other name that they are used also is vulva. And vulva is in gynecology, it's a term of the external female genital organ, except this area which is called mons pubis. As you see in this area, we have the part of the external female genital organ. It's the mons pubis here. This mons pubis is the elevated part of the lower part of the os pubis or pubic bone, which has a triangular shape, and it's approximately the thickness. It's variable between 2 till 8 centimeter, and it contains a lot of fatty tissue in this area. Before puberty, this area is not covered by the hair, and after the puberty, the hair is starting to be appear. Then after the mons pubis, we have this area which is called labia majora. Labia majora is another part, is approximately the length from here till here. It's 8 centimeter. The thickness is approximately 2 till 3 centimeter. This labia majora or the labium majus. Posteriorly, it's connecting together these two labia majora in this area, which is called the commissura labiorum posterior or posterior labial commissure, and anteriorly also it's bordered and or is attaching together in this anterior labium commissure or commissura labiorum anterior, which is separated from the mons pubis. Laterally, this labia majora, it's separated from the region here by this from the femoral region by this fissure or sulcus, which is called genitofemoral groove or genitofemoral sulcus. And finally, the medially, this labia majora, it's separated from the labia minora here via this opening, which is called rima pudendi. Rima pudendi, it's closed for the girls that they are nullipar, in female that after the birth, after the delivery of the child, this rima pudendi, it's more clear and it's more deep, and this is visible for the female that they did the delivery of the baby. Anyway, so in this the labia majora, in this region, you can find some hair also. This hair is called pubes, and also under the skin you can see a small layer of the smooth muscle, like that we had it in the scrotum. Here also we have, which is called tunica dartus labiorum, is the tunica dartus of the under the skin of the labia majora. And finally, the content of this labia majora is a lot of fat tissue, and it contains a lot of venous plexus here. And important is, as we said, that to the labia majora is attaching the round ligament of the uterus or ligamentum teres uteri. Then the next part of the external genital organ is this area, which is called labia minora. Labia minora, which is here and here, it's composed of very thin skin, a skin fold that it's located between the labia majora here. It consists of the loose connective tissue, collagen connective tissue, but without fat, and it's composed of a lot of venous plexus together with the elastic fiber in this area. So the length is approximately 3 till 4 centimeter, and the thickness is 4 till 5 millimeter. Anteriorly, this labia minora, it's going to the area which is called the clitoris, and they are partly is covering, and it's divided to the two parts, this labia minora, so, or two fold, anterior and posterior, or external and internal fold, and partly they are covering the clitoris that I am going to discuss. So the skin of the labia minora, it looks like a mucous membrane, and here in the labia minora we don't have any hair, and it's composed of a lot of sebaceous gland that it's the secret is called smegma. And this smegma, it's the whitish secret that is it's during to the sexual activity. It's this secret is appearing, and it's shading the epithel of this skin in this labia minora. Then another structure of the external female genital organ is the vestibule, is the vestibulum vagina, or vaginal vestibule here. From here, this number 12, from here till here is the vaginal vestibule, and this is the sagittally located between the labia minora. It's located here, and to the vaginal vestibule. It opened the urethra that we already mentioned it in the urinary system. That it's the external urethral orifice, which is approximately is located 2 centimeters behind the glans clitoris. And also it's opened the vagina, the ostium of the vagina here, which is the vaginal ostium. It's located and it's called, and this vaginal ostium, as we said, it's covered by the duplication of the mucous membrane, which is called hymen here, and we said about the type of the hymen already. So to this vaginal vestibule, a lot of minor vestibular glands, they are open around the opening of the urethra. Pardon, this is the external orifice of the female urethra. So in this area, so there are a lot of minor vestibular glands. They are open. And in this case, they are moisturing the vaginal vestibule around the urethra. So this is the external urethral orifice. Then after the minor vestibular gland, we have the major vestibular glands, or it has a name which is called the Bartholin gland. This is those glands. They are the mucinous glands that they are approximately, they have a length around 1 centimeter, and they are located in the posterior part of the labia majora, and they are located deep to the at the urogenital diaphragm, and they have the ducts that they are approximately the length of this duct is approximately 2 centimeters, and they are opening to the vaginal vestibule. And in this case, they are also the moisturing of the whole vaginal vestibule, and in this case, they are playing role as a lubricant. So it's the lubricating of this vaginal vestibules by the addition of the secretion of the minor vestibular gland. They are always keeping the vaginal vestibules moisture, and in this case it's playing role as a lubricant or the lubrication. So if these glands, the Bartholine or the major vestibular gland, there are inflammation or infection is happening, so it's making Bartholinitis. It's the inflammation of the Bartholine gland. Finally, about the external female genital organ, we have the clitoris, which is, as a matter of fact, is an organ, as a cavernous body organ it is, and it has several parts. You don't see inside. There are the crura of the clitoris, which is attaching to the crista phallica in the lower part of the pubic bone. The inferior ramus of the pubic bone. Then we have the body, which is here is covered by the preputium that I'm going to discuss. And then finally is the glans clitoridis. Whole clitoris is approximately, surprising, it's approximately between 6 till 8 centimeters. And the longer lengths that you have it, they have the crura or the crus of the clitoris that is approximately 6 centimeters. As you see, the glans clitoris that is seen here, it's only the length is approximately 6 millimeters. So this clitoris, it's attaching to the pubic bone via the suspensory ligament of the clitoris to the symphysis of the pubis, and the crus of the or crura of the clitoris that you don't see it and is deep. It's covered by the muscle, ischiocavernosus muscle, and the glans clitoris that you see it here in the external female genital organ. It's the round shape, and on the povert and on the surface you have the very thin skin here, and it's covered by the labia partly. It's covered by the labia minora, which is making the frenulum of the clitoris, frenulum of the clitoris, which is here, and in this area that is covering the body of the clitoris is called the preputium of the clitoris, which is partly is covering the glans clitoris. So the main basic structure of the clitoris is the corpus cavernosum or cavernous body that we mentioned it, and it's reached to the labia minora and anteriorly, and it's covered by this labia minora, and it's making the preputium clitoris and the frenulum of the clitoris in this area. And finally, in this area, we have the bulbus vestibuli. Bulbus vestibuli also is the part of the external female genital organ that is mainly composed of the venous plexus, and it's approximately 3 centimeter length and 1 centimeter thickness, and it's located at the base of the anterior part of the labia majora. This right and left bulbus vestibuli or vestibular bulb, it's located between the clitoris between mainly the glans clitoris, and its the basic structure is it's the bulbospongiosus muscle, and in this case the bulb it's mainly lying down on the urogenital diaphragm. So anteriorly it's reached to the clitoris, and posteriorly here it reached to the clitoris, and posteriorly it reached to the centrum perinei, which is between the here and the rectum. So this is anal canal. In this area you have the place that the bulbus vestibule is end up, and it's making the external genital organ of the female. So this is the external female genital organ, and generally, as I said, that it's called the pudendum, or if you don't consider the mons pubis, it's called vulva also. In gynecology, the mons pubis is not considered inside the vulva. So we have it in the macroscopical view. You have this mons pubis that I already said it, that it's covered by the hair after the puberty. Then you are going to this area which are called the labia majora. This labia majora, it has a border with the thigh or femoral region at this groove, which is called the genitofemoral groove. And then you can see here the area of the proputium of the clitoris, which is covering the body of the clitoris. And if you continue here, it's the place of the glans clitoris, and then it's the frenulum of the clitoris. It will be located here. Then you will reach to this area which is called vaginal vestibule, and it's bordered by the labia minora. This too is the labia minora, and here is the external urethral orifice. It's approximately 2 centimeters behind the glans clitoris, and here is the ostium vagina, or vaginal ostium, the orifice of the vagina, which is temporarily covered by the hymen that I said that in forensic medicine is the shape of the hymen. It's important as hymen annularis and hymen defloratus, and defloration and annular, and caruncula hymenalis. It's important for forensic medicine. So posteriorly is the posterior commissure, and then it continue backside to the perineum, and from the perineum is continue with the opening of the anal canal, which is the rectum, which is not seen in this area. So here you can see the part of the clitoris. As we mentioned it, clitoris is approximately, the length is 6 till 8 centimeter. The longest part is this part that in external genital organ you didn't see it, but here after the preparation you can see the crus or crura of the clitoris. That is almost is 6 centimeters is the length, is attaching to the inferior margin of the inferior ramus of the pubic bone. Here is attached, and fixation is by the suspensory ligament of the clitoris is attached, and then it's this crura, and the base of this clitoris is formed by the cavernous body, and in this area it's covered by the superficial external genital muscle as a ischio-cavernous muscle, and here it reached to the area which is called the body of the clitoris, which is follow it forward with the glans clitoris. This body and glans clitoris, it's covered by the continuation of the labia minora, and it's forming the preputium, and partly is covering the body and the glans clitoris. Then here you can see the external urethral orifice, and here is the vaginal vestibule, that in this area they are opening the vagina, the ostium of the vagina. Around the urethra it's opening the minor vestibular gland, and here in this area it's opening, is the place of the opening of the major vestibular gland, or the Bartholin gland. Here that they are making the moisturing of the vaginal vestibule permanently. Then the labia majora, deep to that is the bulbus vestibuli, that it's laying down on the urogenital diaphragm, that it's also is a part of the external genital female organ.
Dear students, that's all about the female genital organs. I hope this video it will be useful for you and you will like it. I would like to thank my colleague Dr. Petrashan for his help, and I wish you have a nice day and study hard and stay safe.